The neck in human beings is divided into two distinct triangular regions. What are they? In front of the sternocleidomastoid we have the anterior triangle. Behind the sternocleidomastoid we have the posterior triangle. These triangles are further subdivided into smaller triangles. Why? Why is this division required? If we see this image, we have the enlarged submandibular salivary gland located in the left side of the neck region. We need to specify in which part of the neck region this swelling is seen. As we have learned, the neck has important structures including number of viscera or organs, blood vessels, cranial nerves. Now these structures have to be identified in specific areas which are bounded by specific boundaries. Organization of neck into such organized boundaried area helps us in localizing these structures, in examining and also during surgical approach to these structures. For example, if we want to approach an enlarged submandibular salivary gland, we know that we have to approach through the submandibular triangle. This is why the entire triangle of the neck is divided into various triangular regions. As we have learnt in the topic of anterior triangle and its subdivisions, we have learned that anterior triangle is divided into 4 further subdivisions. 2 of these important subdivisions are the digastric and the submental triangle. And in this session, let's learn more about these triangles. The learning objectives for this session are, at the end of completing this session, you should be able to describe the boundaries and contents of the digastric triangle and the submental triangle. Let's begin with the boundaries of the digastric triangle. The digastric triangle is a part of or subdivision of the anterior triangle of the neck located below the body of mandible. Why it is called as digastric triangle? It is called as digastric triangle because it is present between the 2 bellies of digastric muscle. We will see this. The digastric triangle is also referred to as the submandibular triangle. It is also referred to as what? Yes, submandibular triangle. Why? Because this is present below the body or base of the mandible. The entire submandibular or digastric triangle has following boundaries. It has got roof, floor, an antero-inferior boundary, a postero-inferior boundary, and it has got a base. Let's try to identify these boundaries. Antero-inferiorly, it is bounded by the anterior belly of digastric. This muscle is the anterior belly of digastric. Then, posterior-inferiorly, we have the posterior belly of digastric. Attached along the upper border of this posterior belly of digastric, we have the stylohyoid muscle. This is the stylohyoid muscle. What about the base then? Base is formed by the lower border of body of the mandible and a line joining this with the mastoid process. So this triangular region is what we refer to as the digastric triangle. What about the roof and floor then? The roof of the submandibular triangle is bounded by skin, superficial fascia, then platysma and investing layer of deep cervical fascia. Right? What about the floor then? The floor is formed by 3 important muscles. Remember, these are the mylohyoid muscle, then we have the hyoglossus, and the third muscle is the middle constrictor. Mylohyoid, hyoglossus and middle constrictor. These muscles will form the floor of the digastric triangle. This is regarding the boundaries of the digastric triangle. What about the contents then? Let's try to identify the contents. Now what we'll do is, we'll draw the outline of the digastric triangle. This is the condylar process of the mandible. This is the digastric or the mesenteric notch, coronoid process, the ramus of the mandible, the angle, and then we have the body of the mandible. Right? Lower down, let's say we have the hyoid bone. Let's say this is the outline of the hyoid bone. Then we have the anterior midline of the neck. The condylar process of the mandible articulates with the articular fossa of the temporal bone. Then let's imagine this is the spine of the sphenoid, and here we have the mastoid process. Let's try to draw the boundaries of the triangle first. The anterior inferior boundary, as we said, is formed by the anterior belly of digastric. The posterior inferior boundary is formed by what? The posterior belly of digastric, along with one more muscle. What is that? That is the stylohyoid, which are connected to the hyoid bone by a sling. This is regarding the boundaries. The entire submandibular triangle is divided by a ligament referred to as stylomandibular ligament, which arises from the styloid process and attaches to the angle of the mandible, dividing the entire submandibular triangle into an anterior part and a posterior part. Let's try to identify the contents of the anterior part. The most important content of the anterior part is the submandibular salivary gland. Okay, so this is the submandibular gland. In front of this lies the tortuous artery. Can you tell me what is this tortuous artery? This is the facial artery. Then behind this we have a vein. What is this vein? This is the facial vein. So these are the three important structures: submandibular salivary gland, facial vein, and facial artery. Apart from this, we have the mylohyoid. This is the mylohyoid vessels, both artery and vein. And then we have the mylohyoid nerve. So let's imagine this is the mylohyoid nerve. Little bit behind, we have one more important nerve. This is the hypoglossal nerve. Okay, so these are the 5 important contents which are seen in the anterior part of the submandibular triangle. What about the posterior part then? The posterior part has one important gland. What is that? This is the parotid gland, the apex of the parotid gland. Okay, so we have the parotid gland. Within the parotid gland, we have few important structures. What are these? The external carotid artery. Let's imagine this is the external carotid artery, and then we have the internal jugular vein. Right? Enclosing this, there is carotid sheath. So the posterior part contains parotid gland and then contains what? The carotid vessels, that is external carotid artery and internal jugular vein, surrounded by the carotid sheath. These are the important contents which are present in the posterior part of digastric triangle. This is regarding the contents of digastric triangle. Once we have learnt about the digastric triangle, let's focus on the submental triangle. The submental triangle, as the name suggests, is present below the chin region. The chin is otherwise referred to as mentum, right? So this is present below the chin in the midline. So this is referred to as submental triangle. Let's try to appreciate the boundaries. The boundaries of the submental triangle are: anteriorly it is bounded by the two anterior bellies of the digastric muscle. The base, as we can see, is formed by what? The hyoid bone. On either side, what we have? This is the anterior belly of digastric muscle. On either side, base is the hyoid bone. The apex is at the symphysis menti, just below the symphysis menti, where both the anterior boundaries meet. This is regarding the two lateral boundaries and the base and also the apex. What about the floor then? As we can see, the floor is formed by what muscle? This is the mylohyoid muscle. Can you tell me, mylohyoid muscle will also form the floor of which other triangle? Yes, it is digastric triangle. So remember, when we talk about the mylohyoid muscle, it forms the floor of two triangles. What are the two triangles? The digastric triangle and the submental triangle. So in both these triangles, the mylohyoid muscle will form the floor. The roof, as we can say, is formed by the skin, the superficial fascia, and the uppermost decussating fibers of platysma, and then the investing layer of deep cervical fascia. This is regarding the boundaries. What about the contents? As we can see in this image, the contents are mainly, what are these? These are the submental lymph nodes. The most important content of submental triangle, the submental lymph nodes. Apart from that, we also have the beginning of what? The anterior jugular veins, which are present on both the sides. So these two are the important contents of the submental triangle. What about the submental triangle? What is its importance? Remember, submental triangle drains tip of the tongue. Okay, so any enlargement of submental lymph node can also suggest pathology of tongue. Okay, so this is regarding the contents of the submental triangle. To summarize, the digastric triangle is also referred to as submandibular triangle. It is bounded above by base of the mandible, a line joining the angle of the mandible to the mastoid process, the posterior belly of digastric and anterior belly of digastric. It is divided by the stylomandibular ligament into an anterior part and a posterior part. Right? The anterior part contains 5 important structures. So what are the structures present in the anterior part? We have the submandibular gland, then we have the facial artery, then we have the facial vein, then we have the mylohyoid vessels and nerves, and finally we have the hypoglossal nerve. Whereas the posterior part has what? Yes, the parotid gland. Which part of the parotid gland? The apex, and then carotid sheath with the external carotid artery and internal jugular vein. This is regarding the contents, boundaries of the digastric triangle. Then we discussed about the boundaries of the submental triangle, bounded on either side by the two anterior bellies of digastric, and then base is found by the hyoid bone. The important content, as we discussed, were the submental lymph nodes and then the beginning of the anterior jugular vein. This is regarding the boundaries, contents of the digastric or submandibular triangle and the submental triangle. That's it for this session.